Now, the other issue today on the show that we're discussing, a link between changes in the menstrual cycle and COVID vaccination is plausible and must be investigated. This according to an editorial published in a peer-reviewed British medical journal. In the editorial, Victoria Marley, a reproductive specialist at the Imperial College in London, UK, noted that periods or unexpected vaginal bleeding are not listed as common side effects of COVID vaccination. Well, to talk more about this, we're joined by Dr. Marley from London. Thank you so much, Doctor, for joining us. And so tell us more about this research that you've done and the findings.
This paper that I've written in the BMJ today is really a call for more research, because in the UK we've had 30,000 people who've reported that they noticed a change with their periods after they had the COVID-19 vaccine. But because of the way that the data was collected, we don't know for sure if there's really a link. And I think it's important to find that out. Now, we are doing research to find that out, but we don't know the answers yet.
Right, Doctor. So why do you think this research is important? Because, you know, while people have been seeing a change in their period cycle or menstruation, and there's a lot of anecdotal accounts of it, but why is it important to know for sure that it's linked to the vaccine, and what impact can it have?
Two reasons. Firstly, in the UK, we're seeing quite a lot of people who are hesitant to get the vaccine because they've heard that rumour that it will impact on their fertility. And actually, research has been done into that, and we have pretty clear evidence that the vaccine doesn't prevent people from getting pregnant. But to sort of sweep these claims that menstrual cycles are changing under the carpet, I think won't help to reassure people. I think it would rather make them feel less reassured. So it's important that we take these reports quite seriously. The other reason is because if there is a link, knowing about it will help people to plan better. So, for example, some people have been in touch with me and their period was quite late after they got the vaccine. This is actually one of the most common things that people notice. And they were very worried that they were pregnant. If we knew for sure, for example, that say 10% of people will have a late period after the vaccine, we could let people know that if their period came a little bit late, it was nothing to worry about. And so that's another reason that it's important to do this research and find out this for sure.
Right, Doctor. So far, what has the response been on this, on your editorial? You're saying that in the UK, you've gathered a lot of data. And do you think it's for the vaccine companies that they're the ones who should gather this data and then inform people? So, as you pointed out, there's a lot of apprehension about the vaccine. So everybody should know and be, have all the information before them.
It would have been good if in the clinical trials they had specifically asked people whether they'd noticed any effect on their periods, because some people in the trials did make a note, oh, I noticed something about my period, but a lot of people didn't say anything one way or the other. And that doesn't necessarily mean they didn't see anything. It might mean that they just didn't think to say anything. So in the future, I hope that when clinical trials are done, we'll include it in the clinical trials. Meanwhile, the research that's being done by this is being done by people like me in universities, and a lot of research is now being funded in the United States of America that aims to do things like look at people's menstrual cycles before and after the vaccine, recruiting people in advance so that we don't bias for people who've noticed a change. And hopefully by taking those approaches, we'll be able to work out if there's really a link here, and if there is, how common it is to notice a change to your periods.
All right. Thank you so much, Dr. Marley, for joining us. Well, to talk more about this entire issue and also women and vaccines, so far what we know, we're joined by Dr. Anita Kant, Chairman and HOD, Gynae and Obstetrics, Asian Institute of Medical Sciences. Thank you so much, Doctor, for joining us. And Dr. Kant, what has your experience been on this issue? Have you got many reports of women saying that their menstrual cycle has changed post the vaccination?
Actually, at our center, we have not noticed any change whatsoever. But yes, like she said, it is a point of concern because women need to know when their periods are coming. That gives them the freedom of holding their day-to-day activities, and also lots of stress is avoided. I feel primarily this could be related to the stress of getting the vaccine, because there is so much attached to the vaccine, not known to us, because it's a new vaccine and people are really scared to go for it also. So that is why whatever happens to them, they are trying to link it to the vaccine. If we have a real study where we see people who had been vaccinated at the same time, in the same month, those who were not vaccinated, and then we can compare and take out statistical correlation whether or not this is a cause, the vaccine is a cause of delayed periods. But otherwise, during pregnancy, and no other feature has been noticed in relation to the COVID vaccine so far.
Right, doctor, you spoke about the vaccine hesitancy. So far what we do know about, the vaccines that we have and women, that pregnant women can go ahead and take the vaccines, that lactating mothers can also take the vaccines. This is something that you must be asked about again and again.
So far, there's been a huge trial in UK as well as USA, and a small trial in India also, where due to COVID vaccine, compared to those who did not get COVID vaccine, the pregnancy outcomes were the same as far as the baby premature delivery or any other complication was concerned. So I feel very safe in telling all my patients that this is the studies so far, and this vaccine is safe for you. Please go ahead and take it to protect yourself and your baby both.
Right, doctor, you also spoke about hesitancy, especially among women, and there's so much misinformation out there. If you could, if Dr. Kant, we can get back with us. Yes. So Dr. Kant, if you could, share with us the kind of rumors and misinformation that we have to make more of an effort to dispel, and it's very different in towns than in rural areas. Also, there's so many rumors around the vaccine and its impact on women that have to be addressed.
Main rumor that is coming across is that the vaccine makes you infertile, that makes a man impotent, and it can kill a baby, and it can also lead to premature deliveries, bleeding, and so on and so forth. So whenever a patient comes in who's pregnant or who's planning a pregnancy, we need to sit down with them and with the proof tell them that this is the proof, these are the studies, this vaccine is not going to harm you or your baby. Please go ahead and take you, because the protective effect is 100 times more for you and your unborn baby, because babies can't be vaccinated. So it's you who will be giving some amount of antibodies that you make in your body to your baby to protect that baby. So this has to be just spread by us doctors to whoever comes across to us, who asks us and who comes for a checkup. And I think slowly we can build up the confidence.
Right, doctor. Now, I know that last year a lot of the gynaes and doctors were actually recommending couples that if they could, to wait before they get pregnant, because, we were in the midst of the pandemic. It was raging earlier this year also. Now, what is the kind of advice you would give to young couples and those who are planning a baby?
They can go ahead. If at all they have to visit the hospital, we know so much more about the coronavirus now. You have to take all the precautions, be safe, and take all the precautions and come to the hospitals or take video consultations. Now, video consultation, telecommunication is a established factor. So I think there's no point in delaying pregnancy now.
All right, so that will be very reassuring for everyone to know, and young couples who are planning any pregnancy during this time. And doctor, so of course the fear is always of that third wave that has been talked about. Though now a lot of doctors are saying it's not going to be as terrible as earlier, and also a lot of confidence, because so many people have gone ahead and got vaccinated. So we have to keep that conversation going and pushing people to go ahead and get vaccines.
I think you're doing a good job by beating all the myths on this TV platform, because many people hear it, and when they have their doubts cleared, they will go for the vaccine. I'm very sure about it.
All right. Thank you so much, Dr. Kant, for joining us on the program.